Starting tomorrow, Minnesotans who use social media will be greeted by a warning label when they open those apps. And the goal is to warn users of possible mental health impacts of using those sites. So we've seen other countries attempt similar strategies. We're just wondering if that actually works.
Well, we are happy to welcome Dr. Joshua Stein back to the fore today. He is a child psychiatrist and the clinical director of Prairie Care. So good to see you. Thanks for coming in. I think a lot of people are interested in this. Yeah. I know that there's concern in social media, especially when it comes to kids and the usage. So what are some of the risks that you see from kids who are overusing social media on a regular basis?
So there's definitely the big things that we're really scared about. You know, kids there's predation, there's kids being exposed to things they're too young for. We see kids who use social media too often and affecting their body image, anxiety, depression, self-esteem. And then there's some of the, I don't know, the more innocuous things, but kind of just people being present but not really there. Just kind of spacing out, being on their phone, being more irritable when you interrupt them. We see a lot of kids who don't get to experience life in the way that you'd want them to. They experience everything through their phone. Nothing's new to them. They've seen it all before. So there's a lot of different ways it can affect us and cause us to miss out.
By the way, I know we're saying kids and we're focusing on that, but a lot of adults too.
Yeah, it is resonating. Let's just say that. So do these warning labels, this is interesting, do they actually change behavior?
So it creates conversation. So as a kid who had the parental explicit, labels show up on CDs back when I was young. It created conversation, it created awareness. And I think most of us at this point have used enough social media to be aware that there's some real detrimental parts to it. It's dangerous and it's scary. The flip side is, we need to talk about it. And so if we can get people being aware, talking about it, kind of seeing this warning and saying, wait, why is this actually showing up now? I think that gives us a really good opportunity to intervene.
An entry point.
Yeah. What should parents do to keep these kids and their kids in a healthy space, healthy place?
So I think one thing is start to look at the technology we have, because there's a lot of opportunities to actually regulate how long your child's on, what they have access to, the hours that they're on it, is it during school or not? There's been a lot of push to make that safer. I think also, I bring this up all the time, if you give your 16-year-old the car keys and they go and drive 100 miles per hour down Highway 100, you're gonna say, thank you, I'll take those back. Like, you've crossed the line, we're gonna work on it again, we're gonna build safety again. And I think social media, phones, tablets, it's the same way.
Repercussions.
Kids are going to push the limits, and then you need to say, okay, we've gone too far, we're going to pull back.
I'm curious if we can, a conversation with your kids about what they see online. Can you give us an example of how you would start that conversation as a parent?
Well, I am a parent, and so we definitely have those conversations. And a lot of times it's just like, has anything made you uncomfortable? Has anything made you feel seen or exposed? Do you have a friend that maybe shared too much or something happened to them online? And has social media ever made you feel kind of worthless or bad? And it's a really good way to jump off. But really with teenagers especially, bringing up, has this happened to a friend? May be a good input point.
That's a good idea.
Yeah. Does it reach a crisis point?
So it can. I work in child psychiatry, I work at Prairie Care, we have inpatient care, we have partial hospital care, and really, there can be crises that occur on social media that families are unaware of that brings children in. It also can be helpful because sometimes kids will share things and let other children know. They're doing a really good job now of advocating and saying, hey, my friend said this, I'm going to call 988 on their behalf, I'm going to call their parents. So sometimes it's also leading to things being seen in a way they haven't before.
If you recognize that's happening, what is a good first step if someone's struggling?
Absolutely. So I think a good first step is 988. And as much as people think of it as a suicide hotline or a suicide crisis line, it's also just a warm line where you can call, you can text.
As a parent?
As a parent,
child
as a teenager. And so we're going to see that with the social media warning. It's going to have 988 on the warning until somebody clicks it and dismisses it. But we don't want barriers. We want people to just be able to call. So if you can touch it and actually start texting, start chatting. Teenagers don't like to call. They like to text. You can text it. But it's just someone you can talk to. They can help direct you. They can help you find care.
Where can people find you?
I'm at Prairie Care, Prairie-Care online, and if you are looking for care, you don't know where to turn, you can always give us a call, and you can touch base with us, and we can help you identify the right services for you.
Okay, super helpful.
Thank you
Good way
so
of
much.
thinking
Yeah,
about
exactly.
it. Great
Absolutely.
to see you.
Thank you.
Very nice to see you.
Yes, good to see you too.